Hello dear friends and students. This is an image-based discussion done by me, Dr. Meenakshi Sundaram A S, MD. And my purpose of this particular session is to help you analyze how you could break it threadbare to answer image-based questions in your entrance exams. So this particular session will focus specifically on the topic of biochemistry, and I'll try to help you with certain important tips which can help you face image-based questions with some amount of confidence. Let's go to the topic here. First, let us look at what kind of questions you can face. And remember students, this is Dr. ASM or Dr. ASM YT, which is the referral code you can use for getting 10% discount on a subscription that you can have on Unacademy for all the upcoming plus courses which are validly done by many faculty. Each subject can have more than one faculty discussing it, so you have unlimited access to all the classes, and for getting this unlimited access you can use my referral code for 10% discount and also for unlimited access to all my classes. Okay, look at the picture here. Consider the following structure. The structure is best described as which of the following? Some questions can be as simple as this particular structure. What is it? It is not a big deal at all. When you look at it, you understand that there is a repeated units of CONH, CONH, CONH. When you see CONH, mark my words, for example, if your compound has COOH plus NH3 coming together, this will create CONH2 bond. This can be called as amide. But when you have only CONH, especially in case of an amino acid structure here, you can look at it as a peptide bond. So mark my words, this is an example of a peptide bond. Also remember, what are the number of amino acids going inside? See, if this is a peptide chain, on one end you'll always be having an amino group. On the other end, you'll be having the carboxylic group. Why? Because if I try to draw the structure of any amino acid, I will be discussing with NH2 usually on the left of my side. Then I'll be having a carbon, then we'll have a COOH. Again, I'll be adding another amino group with a carbon with a COOH. So if they fuse, on one end amino group is free, on the other end carboxylic group is free. So to create this one bond, I utilize the services of two amino acids. So this area is amino acid 1. This area would be amino acid 2. This area would be amino acid 3. And this area would be amino acid 4. So we have 4 amino acids entering into the peptide bond formation. So this is not a structure of an amino acid. This is not a structure of a lipid or a carbohydrate. It is actually 3 peptide chains for 4 amino acids. This is what is a simple question that can look like. So in case of biochemistry, one important thing you have to focus is to look at the structure of compounds. Many people actually take it lightly. They think that structures are very difficult, so people won't be so cruel enough to ask us to remember structures. But mark my words, in AIMS and JIPMA this year, they threw in a picture of chondroitin sulfate and they gave 4 options to identify which compound it was. People had only made the level of efforts to understand what are the components of chondroitin sulfate, but they didn't have enough amount of patience to even look at the structures of chondroitin sulfate. For example, if you look at hyaluronic acid versus glucuronic acid, people do not know how to understand which structure is which. Not just everyone. There are quite a lot of people who do not know when glucuronic acid comes, when hyaluronic acid comes. So when you are not in a position to understand that structure level, then all questions may look difficult for you. So prepare your mind for getting into the depth of all your hard works. So this is one step to tell you how we can go bit by bit, step by step over the difficulty levels in case of picture-based questions. So in biochemistry, try to analyze what are the components present in the structure. What are the things I look at here? I look at the amino group here. I look at the carboxylic group here, and there are continuous things that are repeating here. These repeating units are CONH, and the CONH is called as peptide bond. So the compound has to be a peptide. Now let us up the ante for the next image-based question. The presence of the following compound in the urine of a patient suggests a deficiency in which one of the following enzymes listed below. Now look at the point here. We have GalNAc, glucuronic acid, GalNAc, sulfate is bound this side, sulfate is bound this side. Now this GalNAc means N-acetylated galactose. This is also N-acetylated galactose. And both of them are bound to sulfates as each other. And both of them are together bound to glucuronic acid. So this is the uronic acid and this is the glycosamine. Let me tell you, what is the meaning of the word glycosaminoglycans? When I say glycosamine, the amino group of a particular glucose is right now bound using acetyl part. Plus, what is a glycan? Glycan corresponds to the acid sugar. So the acid sugar here is glucuronic acid and these areas are referred to as glycosamine. So the presence of which of the following in the compound, the presence of the following compound in the urine of a patient suggests deficiency in which of the following enzymes listed below. Here, what do you understand? The whole compound is coming out in the urine. Remember, the last one to be attached to the particular compound will be the first one to be removed. This is the general rule of mucopolysaccharides or any kind of complex polysaccharide. Remember, addition of sulfate is the last thing to be done in the whole picture. Let me erase all the annotations in this picture. Look at the whole picture once again. If at all I want this structure to be ultimately generated, the last moiety to be added to this whole structure would be sulfate. So the first moiety to be removed also will be sulfate. And if sulfated compounds are found in the urine, then logic-wise, sulfatase is the enzyme which is deficient. On these level of questions, there is no specific necessity that you have to know exactly what compound it is. But if you can get the idea of what is importantly present in the compound, that can do most of your work. So in any given kind of compound structure that has been shown to you, look for special moieties. For example, look at the extra amino group in the compound. Look for the extra methyl group in the compound. Look for a sulfate group or a phosphate group in the compound and have an idea about what kind of compound that might be. Here it's a classical case of a mucopolysaccharide because I'm having uronic acid, I'm having acylated glucose, but also I'm having sulfations. So when sulfate is going to be the last to be added, then sulfate should be the first to be removed. And this sulfate is not removed while it is coming out in the urine. So sulfatase should be deficient. So here, making use of common sense statement about a particular compound in a logical question is the next level of looking at questions in case of image-based discussions. Now look at the application part, which can be clinically relevant in case of picture-based questions. In this picture, they are asking you, among the following, who inhibits the process in the parietal cells? What do you think about the parietal cells? Think about all logical things that you know about the fundal cells. You have ECL cells, non-parietal mucous epithelial cells, parietal cells. In the parietal cells, cyclic AMP plays a major role, while you also understand acid can be secreted by the parietal cells into the lumen. Now, when acid cells are actually when acid is coming out into the local area, among the following process, who can inhibit the acid formation? Look at it. Histamine is a strong activator of acid secretion, and also gastrin is a very powerful activator of acid secretion. Now your confusion is between B and C. Now this is one type of biochemical question where you will try to recollect and combine two different subjects together. For this you have to know some basic physiology and you should be knowing the biochemical transport system that is happening near the parietal cells. Also you should know a little bit of pharmacology. Only then you will be able to answer certain kind of MCQs. Imagine in your exams, no question comes with a tag saying that this question is from biochemistry. This question is from medicine. So all the questions should be expecting you to answer the question from all the logic you have learned over the period of 4.5 years of MBBS and 1 year of internship. So that would mean to say that try to use multiple subjects interlinking web to get your answer. Here I can say COX-1 speaks about the prostaglandin synthesis inhibition, and that receptors can be present on both non-parietal and parietal cells. But think about the parietal cells here. You have the relay coming from the M3 area, H2 area and GCCKB area. What is my point here? H1 blockers are not having much to do with your parietal cells in the stomach. What you might have seen here would be H2 blockers. H2 blockers are the ones who are capable of helping you in bringing the acid down. So H1 blocker is not capable of inhibiting the acid secretion. H2 blocker would be capable of inhibiting the secretion. Now atropine is the one who can very specifically or non-specifically inhibit the parietal cells from producing acids. I repeat, histamine is an activator. Gastrin is an activator. H1 blocker is not going to do anything to the parietal cells. But atropine has anticholinergic action, and cholinergic system has the basic vegetative functions of the body. What are the vegetative functions of the body? Think about it. Respiration, cardiovascular system, and digestion and excretion are held by the cholinergic system. So when you give an anticholinergic activity, digestion can be brought down and also the acid secretion can be brought down. So among the following, who can inhibit the process in the parietal cell, that is acid secretion, would be atropine. And this is not much taught by many people, or this is not more thought about by many people, but these kind of questions can come up when you have exams. Let's look at a different type of question. Look at the structure given here. Now they have framed a question around the structure given to you. True statement about the following compound. A. Formation of this compound is the major pathway of ammonia removal by the liver. B. Renal veins have higher levels of this compound than the renal arteries. C. Can be broken down more by the kidneys in the metabolic acidosis. D. The brain cannot convert ammonia to urea. E. The portal venous blood has a higher ammonia concentration than that of systemic blood. Before we think whether any statement is true or false, what is the first necessity here? To identify the structure given here. Now, let me take 1 minute time to help you understand the structure. First, we'll try to draw the structure of a dicarboxylic acid. A dicarboxylic acid is an acid who contains two COOH groups in them. Okay? Why am I speaking about it suddenly? Because I have seen a COOH group here in the given compound, because previously I told you, look for a special group in a given compound. I can also notice the presence of NH2 here. I also notice the presence of a unique construct here, which is CONH2. As previously I told you, what is a CONH2? Yes, CONH2 is supposed to be an amide. Now, what are the different components you notice in this particular structure? Here you have a carboxylic group. Here you have an amino group. Any compound who has at least one carboxylic group and at least one amino group bound to a carbon, which can be either just a single carbon or it can extend to become a huge structure like a side chain, will be qualified to be called as amino acid. So right now what you're looking at is an amino acid, and here look at the dicarboxylic acids here. Now this structure COOH, CH2, 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 COOH is called as glutaric acid. It's called as glutaric acid. Now let me erase all the annotations. COOH, CH2, 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 COOH is called as glutaric acid. So when I try to rewrite the same thing here, COOH, CH2, 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 COOH. Now this is a functional group. This is also equally important functional group. Either I can call this as alpha or I can call this as alpha. If this is alpha, then this is alpha dash. Then if this is alpha, this is alpha dash. Now focus. If in the alpha position I place an amino group, then that is called as alpha amino glutaric acid. How does it actually work out as? COOH, CH2, CH2, CHNH2, COOH. Now this part, where do you see in the given structure? This part is seen here. COOH and NH2, both of them are bound to a carbon. So COOH, NH2, both of them are bound to a carbon, which is bound to a hydrogen, and the rest is bound to a CH2, CH2, COOH. This is called as glutamic acid. Glutamic acid is a dicarboxylic acid. Look at the number of carboxyl groups here, 1 and 2. Because the COOH numbers are more than the NH2 numbers, this is an acidic amino acid. Now what do? I attach one more ammonia to the compound. This ammonia will go back and attach to this particular COOH. Let me erase the annotations once again. So if I redraw, we have COOH, CH2, CH2, CHNH2, COOH, called as glutamic acid. If I add the next ammonia here, this ammonia will make a bond here to form the amide bond. So that becomes CONH2, CH2, CH2, CHNH2 and COOH. I told you just now, glutamic acid is an acidic amino acid because the COOH numbers are more than the amino group. But the moment an ammonia has been added, the number of nitrogens are equal to the number of carboxylic group, then it converts it into a neutral amino acid. That amino acid is called as glutamine. So this is glutamine, where there is one free amino group while the other amino group is bound into the amide bond. So this is a neutral amino acid called as glutamine. Now let me come to the topic here. The question is asking you about the glutamine. The whole structure is glutamine. What are the things you know about glutamine? Remember, glutamine is the mechanism by which an alpha ketoglutarate can actually trap an ammonia to become glutamate. Especially in the brain, you will be having the glutamate trapping one more ammonia in excess to become glutamine. Remember, GLU is glutamate, GLN is glutamine, this compound is glutamine. So formation of this glutamine is the major pathway of ammonia removal by the liver is absolutely wrong. It's funny. Why? Because the major pathway of ammonia removal by the liver is in the form of urea. Urea cycle happens in the liver. So option A is absolutely false. Now look at renal veins having higher levels of this compound than the renal arteries. What is the point here? If I speak about renal veins, they are the ones who collect the blood back. Renal arteries are the ones who are giving blood to the kidneys. Remember, in the kidneys, glutamine is a must to go for acid-base balance. In the kidneys, there is one more enzyme called as glutaminase. That glutaminase can break the glutamine to liberate ammonia. That ammonia can react with H plus present in the kidney tissues to become ammonium ion. If chloride is also lost, you can dispose of the excess H plus in the form of ammonium chloride. So renal arteries will be supplying glutamine and the glutamine can be broken down. Remaining alpha ketoglutarate or glutamate can be taken back by the renal veins. So renal veins having higher levels of this compound than arteries is a wrong statement because renal arteries are bringing the glutamine to the kidney while it is taking back glutamate back into the peripheral circulation. So it has lesser levels. Next, look at it. Can be broken down more by kidneys in metabolic acidosis. That is an absolutely true statement. What is the importance here? Think about it. In the kidney cells, if this is the interstitium, this is the kidney cell and this is the lumen. If at all the H plus concentration increases, that is what is called as acidosis, metabolic acidosis. Bicarbonate has come down and H plus has been elevated. Now what will your body try to do? Your body will try to throw the H plus out. So it will try to throw the H plus out just like that, but it can be helped when glutaminase enzyme is acting in the kidney cell. When the glutaminase acts on glutamine, what will be liberated? I told you, ammonia. That ammonia will bind with the H plus which is about to be going outside to come out as ammonium ion, to which chloride can be attached and can be lost as ammonium chloride salt. So remember, whenever there is acidosis, you have excess amount of H plus in your body waiting to be excreted. So if at all I have a chance of breaking the glutamine by glutaminase, ammonia can be liberated, it can trap the hydrogen and go out. So C is a wonderful statement. Brain cannot convert ammonia to urea is actually not a completely true statement, though it can be acceptable because in brain every single ammonia will be trapped by the alpha ketoglutarate to become glutamate. But the same ammonia can actually go one step forward to accept one more ammonia to convert into glutamine. So glutamine formation is a property of brain. The portal venous blood has a higher ammonia concentration than that of systemic blood is not a true statement because total blood is supposed to take up a lot of your nitrogenous compounds, and when it goes to the liver and comes out, the liver could have broken out the remaining part, the ammonia can be excreted. So remember, portal venous blood having higher ammonia concentration than that of systemic blood is not always a true statement. Sometimes you may have the ammonia going back to the liver. Liver will take up free ammonia and can easily trap them as urea. That is possible. So that when it comes outside, Urea levels may be elevated but not ammonia levels. The same statement can be either a true statement or a false statement. When can it be false? When you are absorbing nutrients, for example proteins from the blood, the nutrients are the ones who are traveling through the portal vein, not free ammonia. And once it goes into the liver and then there's putrefaction happening, then maybe the ammonia can be liberated. So option E is a double-edged sword. Option D is a clear-cut statement. B is false, A is false, C is the right answer. But how can you arrive at this answer? Only when you know that the structure is glutamine. So knowing the structure is of paramount importance. 70% of your answer for this question lies in the structure identification. The remaining 30% lies with your knowledge about the topic of glutamine and kidney-base balance. Now let me show you one more picture. The causes of low thyroxin has been given in the picture. You can actually have secondary hypothyroidism, endemic goiter, primary hypothyroidism, autoimmune thyroiditis, thyroid resection, thyrotropinomy, inflammation of pituitary and hypothalamus. Likewise, there are so many reasons where you can have low thyroxin in the blood. There I have blocked one particular picture and said what is hidden under the block. They are saying it's a poisoning. What kind of poisoning can cause low thyroxin? Low thyroxin can actually be sometimes called as hypothyroidism, though how do you actually make a diagnosis of hypothyroidism? Only when the TSH levels are elevated, you can call them as hypothyroidism. But right now, think about it. What poisoning can actually cause this? Remember, the most important element you can think of which can lead to hypothyroidism would be lithium. But lithium is not there in the given question. The next best answer will always be lead, because theory says that, logic dictates that lead poisoning is capable of causing hypothyroidism. It's a universally true statement. Now in these kind of pictures, you don't need much of your brain to be analyzed. These pictures are just recall memory based picture where the picture is not technically offering anything to the MCQ. The picture is just giving you a visual impulse of the information you're looking at as a question. So here these kind of questions should be navigated only by recall memory. This is one type of question. Okay, look at this picture. This is a clinical feature based question. Now this is the highest level of communication of a knowledge and trying to understand the knowledge using a picture based discussion. A teenager new to your practice comes in for a routine physical examination. His family has just moved to the city and the boy had rarely seen a doctor before. Upon examination, you notice a high arched palate, disproportionately long arms and fingers, a sunken chest and mild scoliosis. The patient has been complaining of lack of breath while doing a routine course, and upon listening to his heart, you detect an aortic regurgitation murmur. Careful examination of the eyes is indicated with the figure below. Based on your physical exam and history, you are suspicious of an inborn error of metabolism in which of the following proteins. First thing first, what are you looking at in the picture? What kind of contribution the picture is making to your question so that it can trigger your answer? There you are looking at the eye part. The lens is actually coming out of the socket. So this is a case of subluxation of lens. And if you watch very carefully, it is superior subluxation of lens. Now in case of biochemistry, there are two major reasons where you can come across subluxation of lens. If there is superior subluxation of lens, it can be found in Marfan syndrome. If it is inferior subluxation of lens, it can be found in hyperhomocystinemia. Let me tell you what is the reason for the subluxation of lens. Be it Marfan syndrome where there is a defect in the vascular fibers, or hyperhomocystinemia where the homocysteine excess levels can interfere with the normal development of the ciliary ligaments present in the local area. So the suspensory ligaments can become very weak. Both in Marfan syndrome and in case of homocystinemia, you can have the suspensory ligaments becoming very weak because of its lenses jumping out of the socket. So my thought process is to see whether it can fit either Marfan syndrome or hyperhomocystinemia. So I'm going back to the case discussion. With the help of the picture, I have cracked one information. From the discussion, we can go to the next level. You're saying a patient has come for routine examination. It means it is not an acute condition. The family has moved just to the city and the boy has rarely seen a doctor before. Upon examination, now look at this. Here in the city, he is not seeing a doctor before, but he has come for a routine examination because nothing is actually bothering him on that spot. Upon examination, he notices a high arched palate. Is high arched palate a part of hyperhomocystinemia? Not necessarily. Disproportionately long arms and fingers? Now it is pointing towards Marfan syndrome. high arched palate inside your oral cavity. The palate can become highly arched and disproportionately long arms and fingers. The total arm span will be longer than your total body height. There can be mild scoliosis because of the poor backbone development. The patient has been complaining of lack of breath while doing routine course. Why? Because you will not be having proper kinds of lung expansion. You will not also be having, in case of Marfan syndrome, the proper chest wall. The chest wall can be compressing that particular person from having a proper breath. You are listening to his heart. Now you understand that there is a regurgitation murmur. Remember, whenever you look at stenotic murmur, it can be a cause where something is accumulating in the local area, because, like for example, vegetation, which is preventing the flow of blood through the valves. But when will you have regurgitation murmur? When the valve has become weaker. What is the function of a cardiac valve? Unidirectional movement across the chambers. From the atrium, it has to go to the ventricles. But if there is a regurgitation, what does it mean? The valves are very, very weak, so that the volume of blood is going back, forth and forward. Increasing in the volume of flow across the valve is reason for regurgitation. So now I understand in almost all the connective tissue areas, I have some kind of defect. And this is actually confirming I thought that it can be Marfan syndrome. If it is Marfan syndrome, the defect is with the protein called as fibrillin. This was also seen in case of Abraham Lincoln. Now let me look at the theory part here. Fibrillin is an extracellular protein. So you can consider it as a intracellular matrix area, and also it can be a part of connective tissue area. Next, fibrillin can also help in the formation of other proteins, microfibrils, which are present in the elastic fibers. So remember, fibrillin can support elastic fibers, the second information. Third, if at all fibrin is there, it helps the various tissues have their elastic properties also through the elastic fibers. Next, the exact mechanism whereby the mutations in fibrillin is going towards Marfan syndrome is not very known. But remember, mutations in any of the other proteins listed do not give rise to Marfan syndrome. Who are the other proteins? If we speak about collagen, elastin, dystrophin, beta-catenin, none of them are capable of causing Marfan-like syndrome. Now this, what you saw as clinical picture, is called as Marfanoid habitus. It means all the features are similar to either Marfan syndrome or like Marfan syndrome. And what are the theory parts you have to know? Marfan's is an autosomal dominant disorder of connective tissue. It's not a disorder of collagen. It's not a collagen vascular disorder. It's a fibrillin disorder. It is caused by mutation in FB1 gene, that is the one that is coding for fibrillin 1, which is a glycoprotein. The picture is of a dislocated lens, which is classical of Marfan syndrome. So, looking at the picture, try to understand how the picture can fit with the thought process you have. Try to bring out the information that you have, something around the picture. Try to link it. If at all you try to do it the first time in the exam hall, you'll be scared. That is why attend as many number of image-based discussions as possible, be it on Unacademy or anywhere else. And if you do it consistently, then you will be a successor. You'll be a successful person. Why? Because remember, practice makes a man or a woman perfect. Point number one. Also, the more you practice, you sweat. The more you sweat in the practice field, the less you will bleed in the battlefield. So, these are my small steps, simple steps to help you realize that image-based discussion is not a big deal in case of biochemistry. You can't take it lightly, but at the same time, don't take it so seriously so that you'll be burdened by the depressive thoughts and anxiety thoughts. In biochemistry, focus on structures. Give it the due importance it deserves. Second, use the structures to analyze what you know about the theory behind the structure. Third, try to link the clinical picture. When you can do all the three things, the fourth thing is that combining biochemistry as a subject with other subjects to come to a common concept. When the web is created, you will not be able to forget the information even if there is a loss of information at some point of time. When you know something in the web, you'll be able to finish the web at the end of the session. So with this basic help, I can tell you, I'll take your leave. Thank you very much for being very patient in watching the class. And if you would wish to subscribe to the Plus classes in Unacademy, please use the code DRASM or DRASMYT. You can follow me on Instagram by searching for this ID, Win Emperor. So if you have any questions, you can ask me. I will try to help you either on Instagram or on Unacademy or on Telegram group. Have a great day. Bye-bye.